Let's talk quickly about fat absorption inhibitors. Orlistat, which is sold as Xenical, is sold as an obesity treatment, but it does have a reduction in cholesterol too. Now, 50% of patients who take Orlistat have a 5% reduction in body mass. The reduction in diabetes mellitus incidence is also recorded, probably related to weight loss. There's a modest reduction in blood pressure and a mild reduction in LDL as well. Now, this reduction in LDL is actually independent of the weight loss. So whatever weight loss you get from, whatever LDL reduction you get from weight loss, there seems to be a little bit more. In terms of the side effects of Orlistat, the FDA recently released a warning about hepatotoxicity or possible hepatotoxicity, but this flies in the face of some evidence from the United Kingdom, which used a 94,000 patient study to show no causal increase in hepatic injury with this medication. We're still going to be very careful in clinical practice, but just to let you know that there's a bit of a debate on this. There is an increase in renal failure that's been documented, and there's a theoretical concern about colon carcinoma because we think that there may be a possible link between the content of fecal fat and colon cancer, although that hasn't been proven at this point in time. Let's move on to the MTP inhibitors. This is a new class of drugs. They're fiendishly expensive, but they're now coming onto the market. The prototypical drug, I would say, is lopetamide or Juxtapid. It's an oral tablet. Now, it acts on the microsomal triglyceride transfer protein, or MTP, and it is an inhibitor of that protein. VLDL and triglyceride assembly and secretion in the liver is what is being affected here. It is used for the treatment of familial hypercholesterolemia. And what it does is it reduces VLDL and all of the non-HDL fraction of the cholesterol profile. It also will reduce apolipoprotein B. Because remember that apolipoprotein B are these proteins that are going to be attached to either VLDL or LDL. It can be used in combination with statins, and some reports indicate up to 60% reduction in LDL cholesterol with these medications. The adverse events, it may increase hepatic triglyceride levels, and it may cause a transaminitis. Mimopirsin is also an ApoB inhibitor, and it is a once-a-week injection. It targets the messenger RNA for ApoB. For the treatment of homozygous familial hypercholesterolemia. We call that HoFH to distinguish it from HeFH, which is heterozygous familial hypercholesterolemia. With this treatment, you get a 25% reduction of LDL. And remember that these are a group of patients who don't respond well to statins, so a 25% reduction in these people is actually pretty good. It decreases hepatic and plasma ApoB and C3. It can be used in combination with statins as well. The adverse events, once again, it may increase hepatic triglyceride levels and, of course, a transaminitis.